Good morning from the second age of reason. Today's secret words are temporarily able-bodied. A new discussion about healthcare. In America. The other day I was having a discussion about healthcare in America with a person from another country. And frankly, they were quite surprised that America has such a crummy healthcare system, and that the way it is. And they don't understand why we just don't get the program like the way they do in Europe and the way they do in Canada and other places, what we call single-payer, government-paid-for healthcare. Now, there's a difference between government paid for and government controlled. The government can in no way hope to really control healthcare. The medical system, the clinical practice, and all of that is of a size and scope that is so big, the government could not even hope to scratch the surface of it. But the government does have funds. The government is the source of money. So they could fund it. Maybe they didn't spend so much money on war. It would become much more affordable. And there's other things that make single-payer, completely covered healthcare affordable. Number one, eliminate the insurance company middleman. They are the ones who make it more expensive. They are the ones who raise the premiums. They are the ones who don't pay the benefits if they can get out of it. So, by eliminating that, you eliminate hundreds of billions of dollars. Secondly, you have other issues that are playing into the system. For instance, you have we'll simplify the whole business process. Right now, there's so many insurances and so many different coverages that it is a huge administrative nightmare. So simply change the rule set. Okay? Number one, who is covered? Everyone. Makes it so simple to decide eligibility. Number one, what is covered? Everything. That makes it very simple to decide what's covered and what's not. And how is it paid? Between government and provider. That way you take out the insurance companies and you take out the patient part of it, and the business process becomes so much more streamlined. Next is, what other benefits are there to this? Number one, to state and local governments. State and local governments are really hurting now because to maintain the high-quality health benefits they've been renowned for, the costs have been going through the roof. This is because each municipality, each state has to negotiate their own contracts, has to negotiate their own rates. And this allows for a lot more chances to be cornered in the market. So, if the federal government were to take over the whole financing aspect of it, those extreme costs would fall away from state and local governments, making them much more solvent and able to take care of their people better. The other aspect of it is for private businesses. How does it help them? Well, private businesses that provide insurance are paying a tremendous amount of money for those premiums. And so that expense will be removed from them and the money added directly to their bottom line. In fact, it's probably what causes a lot of jobs to move overseas, is that the other countries give the employees free health care. And the health care for the employees is no longer a drag on the bottom line. So by doing so in America, it would put our employees on an even playing field. The second thing, or third thing, is the control of the system. Some people say that the government will control health care and will tell you what you can and cannot have. And I'm what I'm proposing is the government not controlling the healthcare, the clinical practice itself, but only the financing of it. The control of the healthcare, of what you get for treatment or not, should be strictly between you and your doctor, and there should be patient privacy. That means that between you and family members, the information should be freely available. Between you and your health and the employer should not have access to that information. Between you and your information for the government should not have access to your information. And you and your creditors, they should not have access to your healthcare information. Period. The end. And that way it is kept legitimate and free from corruption. Because actually corruption is the big problem in a lot of the systems. So the other aspect is some people say, why should I pay into a system that will help all these sickly people, all these people who have ruined their lives and don't contribute anything to the system, to the economy or whatever. And they have that idea that there's all these lazy loafers laying about who want to get free health care, and I can't just imagine a bunch of people sitting around waiting for the free health care so they can go to the doctor and have stuff done to them. It doesn't seem plausible. So I think that's a misnomer right there. Also, there are people who are sickly because of things they've done to themselves. There are people who are sickly and whatever because of things they've been born with, because they've been victims of some things, because of accidents. You can't really avoid the health system entirely. I mean, you have to be born, and it's usually in a hospital. And then when you're old, your body tends to fall apart, and you need more health care when you're old and retired, when you're not working with an employer. Hence, the great need for Medicare. So, the key words here for today: temporarily able-bodied. That's all of us. Sure, today you're well. Maybe you're taking good care of yourself. But you could be in an accident. Or you could come down with an incurable disease. Or a cancer, which may be curable. And if you have some insurance companies will tell you, well, the treatments are experimental. The treatments are not proven to be effective. And things like that, and trying to get out of covering it. By the time they do approve it, it's usually too late. Whereas if the system was simply said, the doctor says it's necessary, then it's necessary. So, that's kind of the thought I want to leave you with in how to justify a single-payer health system. We thought we might have this sort of a change coming after the last election in 2008, but I don't think so. Hopefully you'll be more circumspect in the 2010 and 2012 elections, and ask your Congress people, well, why not? Tell them what you want, and if they don't come through, you have a voting booth to change things. Then you can be the change. So for now, from sunny Alpharetta, Georgia, I'll be saying goodbye. Please rate and comment below, and until later, be seeing you.